Hello all, I'm Dr. Neema Bhat. I'm a hematologist, PMT physician and a pediatric oncologist. I take care of patients who have multiple hematological problems. So hematology is probably a specialty you've not heard of much, but we are specially trained physicians who can take care of patients with anemia, which is low hemoglobin, thrombocytopenia, which means low platelet counts, leukemia, which is blood cancer, lymphoma, which is cancer of the organs that purify our blood, any disorders related to bone marrow like bone marrow failure syndromes, thalassemia, which is a type of abnormal hemoglobin, sickle cell anemia, again another type of abnormal hemoglobin. We take care of patients with multiple myeloma, recurrent lymphoma, and various other types of blood disorders. We perform procedures called bone marrow aspiration and biopsy, which is nothing but going to the site of production of blood and taking a sample to find out what exactly is causing the abnormality in blood counts or blood disorders. Apart from this, we also perform highly advanced procedures called bone marrow transplantations, autologous and allogenic for pediatric as well as adult patients. I'm also a pediatric oncologist, which means I take care of children with blood disorders like leukemia, lymphoma, anemia, again low counts, and thalassemia and sickle cell anemia, and perform bone marrow transplants for all these conditions wherever it is required. At Healius Cancer and Hematology clinics, we mainly strive to offer the right multidisciplined and wholesome approach with respect to cancer and hematological conditions. So at Healius we are practicing physicians of medical oncologists, hematologists, surgical oncologists and radiation oncologists. So whenever a patient walks in with any cancer or cancer related disease, we try to give it a multidisciplinary approach and give the best treatment possible, of course hoping for the best outcomes. At the same time being cost sensitive and making sure that the patient gets a very personable experience, unlike the hospitals. The waiting time is very short over here because we have put our heart and soul into trying to making sure that the supportive care staff are very sensitive to getting the patients very comfortable and finishing their treatment and leaving out of the center as soon as possible. So you don't have to wait in long lines to either get medications or at admission desks or admission counters to just be able to get a bed. So from that end, a daycare setup like this one serves a great purpose. Apart from that, you will find that this doesn't look like a natural, it doesn't look like a hospital, it looks more of what we say a daycare setup. So it has individual rooms but also has lounging chairs and has a very personable feel to it, and you will also find that the doctors are very personable. So please feel free to reach out to us either on our website or come into the clinic for any visits or appointments. Thank you.